Have you been exposed to mold or think you've been exposed to mold? Then this is the video for you. Hi, I'm Dr. Angela Jaeggli. Welcome to Sage Health TV. Today I'm going to dive into what you need to do to actually confirm or monitor the presence of mold in your system. Mold is really insidious. It's everywhere, especially if you live in the Pacific Northwest. We have a ton of mold outside, but what you don't want is you don't want it inside your house. And what's really interesting about mold is that it really can impact people differently. You can have a family in the house and it's one person that's extremely sick, and it's like, oh, it can't be the house because everybody else is fine. And really we're understanding now that that's actually comes back to genetics. There are very specific genetic markers that can predispose people to having like a serious problem with the mold toxins in the space. So something to consider. This is really when we start thinking about mold. When we get people that are coming in, they have an unusual set of symptoms that are together, and they seem to kind of start at a certain time. So it's kind of like, well, gosh, when I moved into this house or when I started work at this place, then all of a sudden my health just tanked and it went downhill. And it's like, symptoms are, if you're looking here, cognitive, like we see memory change, we see brain fog, cardio, people will get heart palpitations or shortness of breath. I had someone who, super fit young woman, she's like 28 doing CrossFit, could not breathe, and all of a sudden just became extremely exhausted. Her life just fell apart. Fatigue is probably the number one, and that's probably the one that people start searching, like, why am I just so exhausted? And they start, oh, is it my thyroid? Is it my adrenal glands? And everything is looking really good, and like, what is wrong with me? And then pain or multiple chemical sensitivity. So they start noticing that, reacting to everything. It's like somebody comes in with a little perfume, and it's like, oh my God, it's giving me a headache. That's horrible. Now, there are other things that can cause MCS or chemical sensitivity. So it doesn't have to be mold, but it should be on your radar. So the way to start, most people, one, you got to test your home. That's with an ERMI test. You can get these online, ERMI. There are some that are better than others. I like the one recommended by Richard Shoemaker. He's one of the top docs, mold specialist. But you can get it from other local businesses as well. We also use somebody called Jason. His name is Jason Kester, and I think it's kesterclean.com. This will all be in the notes. He's fantastic. He does not actually do the remediation or the cleaning, so we really trust. He's going to tell you straight. He's not going to be trying to sell you something. So getting a mold specialist that also does not do the mold remediation, I think it's important. Okay, so getting into your body, like what should you be looking for? This is going to be a longer video, but I wanted to give you a lot of information because this topic is complicated and people can go for years without any resolution or understanding of why they're so sick. So starting out, we really like this Great Plains Lab urine mycotoxin panel. It's out of pocket, it's about $300, but they look at like the top 11 mold toxins, and how that helps us is that when people have very specific toxins, there are more specific agents that can help them in treatment. So today is really just going to be about testing, but I want you to come back. We're going to have another 2-part series just on treatment. It's going to be fantastic. And so really we want this one, not only just to measure what you've been exposed to, but also, it helps us guide treatment. We also want you to do some glutathione, which is an antioxidant, before you get this test, because we're really trying to bind up those toxins and excrete them. So glutathione is a really good chelator as well as a binder of just, toxins in general. Then blood. Okay, so this is where it gets a little crazy. So first I want to point this out. So this is from Dr. Hartwick. He is another mold specialist on the East Coast, made this fantastic pyramid. And just kind of talking about, what's number one, removing exposure. I'm not going to talk about treatment today. We'll go over that next time. Starting with MARCoNS, and again, I'm going to explain these, this is a bacterial test, gluten, androgens, and then on up. So, but doesn't mean you can't do all of this at one time. That's completely fine. I want to tell you a little bit about what these mean. So, because it's a lot of testing, and to try to understand it yourself, you really shouldn't be trying to understand it yourself. You really need a specialist to walk you through this. And I would consider us specialists in mold toxicity, here at Sage, but also you can find them, functional medicine, naturopathic doctors that specialize in this too in your area. So starting out, C3A and C4A are inflammatory markers. They're proteins, complement proteins that are measured, and they're associated with your immune system. They have some different actions. Mold people tend to be low in C3A, high in C4A. They're really just driving dysfunction of your immune system. And a lot of that can be driving how you feel achy, your body's aching. You just don't, you feel like you're kind of coming down with something, that's part of, they're responsible for that. And what's interesting too, I want to make a little distinction, is that, say for instance, C3A is high in Lyme disease. So you're going to get a lot of crossover. You're going to get a lot of people who are positive in Lyme that have very similar symptoms. And you can have Lyme and mold, unfortunately. And sometimes having mold predisposes you to your body not being able to resolve the Lyme. Your body cannot kick that infection. So there can be both, and both should be looked at. TGF-beta1 is one we can do very easily. A lot of these we can do in office through Quest. Sometimes we also send out to LabCorp, but two national well-known labs, and can be run through insurance, which is really great. So TGF-beta1 is also regulating your immune system, and we tend to find it to be really high. I would say it's the most specific. Like, I've seen people absolutely confirm mycotoxin, absolutely confirmed mold in their house, where everything else is normal. You get all of this back and you're like, wow, you look pretty good. And then this TGF-beta1 is like, rah, it's crazy. And so we can use that as actually a monitoring measurement for you and how you're responding to treatment. I mean, part of that is going to be how you're feeling, but we want to say that TGF-beta1 come down. Low VIP, it's vasoactive intestinal polypeptide. This is really important, and this comes back to that CrossFit patient I was talking about. One of her top first symptoms was shortness of breath. She could not breathe. And she was like, something's wrong with me. I have asthma. And they're pulmonologists. Everybody's like, you don't have asthma. You're fine. And it was this. And she also had Cirs, which is CIRS, which is basically complex inflammatory regional syndrome. But basically that goes along with, he talks about special treatment for Cirs. That's what that is. It's just basically the inflammation complement or, action that happens whenever you have this in your body. It's a more serious form of mold toxicity. Low MSH, really, so this comes back to pituitary gland that's in the brain and talks to the rest of your body about your hormones. So your hormones really can become dysregulated from this. So we really like to dive in and check cortisol and DHEA, SHBG, which is a binding globulin, and then all the other hormones. If you're seeming like you're having estrogen dysfunction or testosterone, it can all be linked to that. So we're checking that too. High MMP. So this is a biotoxin that really pushes this or biotoxins push that marker to release, and it creates a lot of inflammation. ADH is all about electrolytes. So a lot of people have a hard time with mold, like balancing their electrolytes. So I'm like, why all of a sudden I feel, I do something, I sweat, and I'm like completely lightheaded. It's like your potassium, your sodium, your chloride is just not being regulated. So we need to check that. We talked about androgens. Gluten, strangely enough, people have more of a reaction to gluten, and those are the gliadin antibodies. We check those anyway I even check it as a preventative because it's so common these days, but it's very important in this situation. Leptins, a lot of people think about that with weight loss. But in this instance, it's just another thing that we can monitor, because you'll find whenever that inflammation is present, it becomes much more difficult to lose weight, and leptin is involved in that process. And then your genes. So this one I'm going to give you a chart in the write-up on this. I wouldn't get it too attached to this. It's very interesting because it can help you if you're like, again, you're like, I'm the only one in my family that is sick. Like, this doesn't make sense. I must be something very serious. Mold is serious, but you're thinking like, oh gosh, it must be something really, very, very serious. But it can be sometimes kind of relieving if you see that you're like, wow, I have all the genes that are positive that make me more susceptible to this. So this is something you can get in like your, like if you convert your ancestry.com into mthf4support.com, you can find all your HLA genes, or what they're called. So you can match that with the chart that I'll include in this. And then MARCoNS. So MARCoNS is basically a nasal swab test that looks for a particular bacteria that lives in your nose. And it tends to be very present with people who have mold issues. So we have to give a specialized, antibiotic nasal spray, which luckily stays very local. So for people who have, they don't want to have any antibiotics, which I totally understand. So it becomes pretty easy treatment. So this is the beginning. And so thank you for staying with me and going through all of this. I hope it's been helpful. You can find all of this write up in our blog that will be attached to this, and it will have even more detail. So if you are dealing with this and you don't happen to be here and you're working with your doctor, although of course if you're anywhere near us, we also do Zoom appointments, things like that. We would love to be the ones to work with you on this. So if you have any questions, please reach out to us. Thank you so much for joining us, and I will see you next time.